All right, I think the numbers have slowed down a little bit, and I know folks will continue to join us, but I think for the sake of time, we can go ahead and get started. Thank you for joining us today for the Research in Progress webinar series. My name is Carrington Lott. I'm the Deputy Director at Systems for Action. If you're not familiar with Systems for Action, we're a signature research program office of the Robert Wood Johnson Foundation. We are housed at the Colorado School of Public Health in the Health Systems Management and Policy Department. And a big part of what we do at Systems for Action is release annual funding opportunities, looking for innovative ideas of aligning across systems, so the medical, public health, and social services systems. This project that you are coming to hear about today is one of the teams that received funding from our 2022 funding opportunity. They are a developmental award, and we have funded them for 12 months, and they are well into their project. And I know they're going to have some exciting updates to share with you. So you're going to be hearing today from our team at Coeur on their project, Tribal Care Coordination Dashboard, Core Adolescent Support Team, or CAST, Intake and Referrals. If we could go to the next slide, Sedina. Thank you. So this is our agenda for today. You're hearing the welcome from me right now, and I'll go over a couple of housekeeping items in a moment, and then we'll hear from our presenters themselves for the majority of today, and they will hand it over to some folks from the Coeur d'Alene tribe to provide some commentary on the importance of this research in their community. And then we will reserve 10 or 15 minutes for questions and answers at the very end. If you have any questions at any point during today's webinar, please locate the Q&A box at the bottom of your Zoom screen, enter your question in, and we'll make sure that we reserve some time at the end to answer that. And I think with that, I'm going to let the Coeur d'Alene tribe do introductions of themselves and just move right into the project. So thanks again for joining us, and looking forward to diving in more to this project and learning more.
Awesome. Thank you so much, Carrington, and hello to everyone. I want to welcome all those who are joining us today to learn about our project. My name is Elva Allen, known by my nickname of Cookie, and I am the principal investigator for this Tribal Care Coordination Dashboard project. So I work with the Coeur d'Alene tribe in North Idaho, and I'll briefly introduce our presenters for the webinar today. Please see our bios in the on the website for more info, so as I'll quickly go through it, the introductions. But first we have Marquette Hendricks, a member of the Coeur d'Alene tribe and the senior data analyst with the tribe. We have Dr. Myra Parker, who is the director of the 7 Directions program at the University of Washington, and Dr. Christina Ore, also of the University of Washington, and an associate director for the 7 Directions program. They are working to provide technical assistance and research assistance to us. So in addition, we have 2 people from our community that will be providing commentary. We have Joey Buckner, who is the tribe's works for the Coeur d'Alene tribe in the Marimn Health Center. She is the Well Variety Services Manager and oversees the program centered for this project, the Core Adolescent Support Team, also known as CAST. And we'll have a few more details on that later. And we also have Tammy Dorman, a member of the CAST team and the manager of the Education Department's Native American Career and Technical Education program. So on this slide here, well, before I get into this slide here, we do want to take a moment to thank our S4A partners, and especially Dr. Mays and Carrington and Sedina, for all their guidance, patience, and support. Not easy to balance all these grantees. We are honored to share the work and research that we are partnering with the Robert Wood Johnson Foundation to produce. In the slides ahead, we'll describe the project, give a little background of why this project is needed, and hopefully have some visuals that will help tell our story and not overwhelm. I found that when we were putting together this slide that is for a 1-hour presentation, it was just as hard to condense everything into 1 hour as it was to do the 5-minute presentation that we had to do earlier in the year. So no matter what, there's a lot to share, and we're excited to do that. I also wanted to mention that in addition to the presenters today, we want to recognize other project team members and contributors that include Dr. Chris Meyer, Education Director, and Rhea Jansen and David Romero, who work with the Strategic Initiatives Office. So on this slide here, we are trying to capture all of that involvement and participation, starting with our advisory board, who is the Tribal Collaboration Committee. It's made up of tribal leaders from the Coeur d'Alene tribe, elected leaders and administrative leaders, as well as involvement from Marimm Health, the tribal social services, law and order, and education departments as well. Our project team involves team members from the Strategic Initiatives Office, Department of Education, and the University of Washington, 7 Directions, as well as some involvement from our tribal IT, and then the partners, obviously the Youth Advocacy Services Program that works with the Coeur Adolescent Support Team, the CAST team, and their referring partners. So in the next slide, oh, well, before we get too far, we did want to, we wanted to take the opportunity to highlight the importance of centering sovereignty and the tribal experience. And so I'll turn that over to Christina to do a little bit of that for us.
Thank you, Cookie. Briefly, this study is by and for the Coeur d'Alene tribe. Its purpose is to pilot a referral system and dash system with specific program with the aspiration of a wide system that'll serve tribal citizens and community members. So again, before sharing more about the study, I'd like to highlight how it falls within Indigenous data sovereignty and governance movement in the US, in which systems of finance, governance, data are established, enhanced, so that Indigenous data is accessible, of relevance and quality for use by leadership and upper management, as well as reciprocally, tribal leadership can practice governance or stewardship of the tribe's data. So done through data sharing agreements or tribal data codes. This bidirectional relationship ensures respect for and the practice of tribal sovereignty to enhance, strengthen existing systems and engage in rebuilding where and how prioritized by tribal leadership. So just a quick context for tribal governance and the place in which this study holds within the U.S. Indigenous data sovereignty and governance movement. Thank you.
Thank you, Christina. And a little more additional background is, as I mentioned before, we're located in North Idaho. The membership for the Coeur d'Alene tribe is about 2,600 members, about half who live on reservation, but the reservation population itself is about 8,000 people, definitely a rural setting. The tribe has historically been a responsible neighbor, meaning that they offer many health, social, public safety, and education services to the majority of tribal and non-tribal members within this reservation community. But nonetheless, the tribe strives to be better. So in 2015, the tribe sought to improve public health and safety services throughout the community by forming that tribal collaboration committee that I mentioned earlier, a team of 25 leaders and staff. This team conducted an environmental scan that recognized the need for streamlined intake and referrals systems, but they also found that services were lacking for support and interventions that were needed for youth ages 12 to 17. What we found in that scan was that service providers were working in silos with little information sharing and virtually no referrals being made from the schools. And so in response to this, the tribe established the Youth Advocacy Services Program that has staff that work and provide case management for tribal youth in need of interventions, and also created this Coeur Adolescent Support Team, the CAST, which is a multidisciplinary team to provide that wraparound care and case management, streamlining services and connecting them with the resources that they need. Yeah, let's advance, sorry, to the next slide, please. So this is what that Coeur Adolescent Support Team looks like. We have a bunch of different people at the table, and this will be described in more detail later with our guests, panelists, Tammy and Joey. So basically the purpose and goal of this project, as you can see on the slide, is to we aim to study how tribal organizations can create and implement an Indigenous youth care coordination dashboard aimed at improving access to health and wellness services for youth using a tribally aligned intake and referral system. There you see the visual of what our dashboards hopefully will look like, or are starting to look like. And we are hopeful that this project will support community leaders and service staff in accessing real-time data and information to optimize decision-making. Next slide, please. So many tribes are striving to collect better data that tell the stories and to better inform the decision-making and the programming that's being built. In this slide, I kind of put a graphic there that oversees a tribal justice systems database that this dashboard project is a part of. So part of the inequity that communities such as ours face are that our database systems are used for mandatory data collection and reporting that is provided by funders, but doesn't often collect the data that actually tells the full story. And the full story is often known by the community members, by the tribal residents themselves. So we're aiming to create a system that generates the data that we know we need. So we know that creating a universal intake and referral system will provide really key demographic information such as age, gender, tribal affiliation, services, and locality where people live, and put into dashboards. This can help us make sure that we are aligning our services, that we're keeping up on the trends and interventions needed, and that we have accountability with the programs that are providing services. As such, our primary objectives for this project are to design and map the tribe's intake and referral system and support network, and establish the indicators to be included in the tribe's dashboard and develop these dashboards. And also to research other tribal or non-tribal referral systems to help inform our model for this system. So yeah, we're looking to make improvements, because currently we do most of our programs that work with tribal youth do utilize their own intake and application forms. Most of them are on paper, they're not digitized. This can be cumbersome for the clients seeking many different services, and the information that they provide at each different stop that they go to can be can look different from one form to the next. There is no formal internal referrals process that we have here with the tribe, nor external. Most referrals are done via phone, email, or in person, and we know that valuable data exists within these forms and these processes, but it's largely inaccessible and inconsistent. So we wanted to target and pilot a CAST intake and referrals process for this project, because we know that they engage and connect youth and families to many holistic services. Again, Tammy and Joy will describe those later in our presentation. And our office is excited to partner with the University of Washington 7 Directions program to perform the research needed to better understand and document the unique conditions that contribute to health inequity in tribal communities. Next slide, please. So in this slide, we have the phases, milestones, and timeline. We've broken up our work into 3 phases, which I think a lot of us grantees know that everything doesn't go specifically as planned. A lot of the stuff overlaps and takes longer than we think. So a lot of these are in play as we speak. In that first phase, we were looking to do the literature review and some scans. We wanted to establish data sharing agreements with the different service providers that will be providing data that will be in our dashboards. We wanted to look at existing plans and research other tribes or non-tribal organizations that are doing similar projects. We wanted to do interviews and draft interview guides and data collection tools, and then share all this with our tribal advisory board. In phase 2, which is kind of, we're in the thick of that, we are doing and conducting interviews with end users and developers to better understand the circumstances needed for developing a universal intake, as well as the referral system. We're trying to map it all out to see how, these referrals are needing to connect and where. And then devising the referral system and revising it as needed, and then figuring out how to then export that information into these dashboards. And finally, in phase 3, we are looking to expand to produce an expansion plan for how we can then implement this system throughout the tribe with a mapped process. That includes support documents like the training guides for the staff in using the intake and the referrals. This is going to be very new to a lot of people. We're looking to draft the procedures for review and revision of the referral system, and also to prepare the summaries for data for future studies, and to present it to our tribal leadership to decide what the next steps are going to be with this system, and hopefully implementation. Next slide, please. So in this slide, we kind of quickly are trying to show what has come out of our literature review with this conceptual framework. We have built on the Robert Wood Johnson Foundation's previous work through the Georgia Health Policy Center in developing an initial tribal cross-sector alignment theory of change, which has been adapted to represent the tribe's work. You can see that we've added partners. Well, if you were familiar with the previous or original version of this, the public health, the social services were the main parties or participants. But in our work, we have included public safety, which is our law and order department, as well as education, and our tribal leadership is at the table too. In many communities such as ours, tribal staff are related and connected to a lot of people that they work with and serve, including our youth who are needing these interventions. And so we are also hoping and working to utilize and incorporate cultural and traditional practices and resources that are critical to better align and engage with the community, the tribal community that we serve. Myra will come in here to speak a little more to this literature review.
Yeah, I just wanted to highlight some of the important things that we saw in the literature, which is limited, to say the least, for tribal communities and looking at health system alignment with other support services. One paper that does include tribal communities by Jock and colleagues in 2022 actually identified the need to address structural determinants of health within Indigenous communities, and the importance of confirming them with the tribal community, with both members of the community as well as tribal leadership, to really be able to understand how to then develop strategies to address those factors and to reduce the barriers of access to care and the connection across services. And so you can see on the bottom bar, the strong community engagement and tribal leadership was one thing that was already anticipated that would be built in, and the literature review that we conducted confirmed that decision and characteristic of this project's approach. In addition, Acosta and colleagues noted in their 2022 paper that there's a real need to modernize public data systems. And as Cookie was just talking about earlier, a lot of it is because of the different sponsors that fund these different types of services that are available through the federal government, as well as perhaps some state agencies, and the need to really think about how that then creates kind of a cascade across different systems. So for a tribal system, they may be funded by, 5 to 10 federal partners along with different state agencies. And so kind of marrying those together to be able to standardize the data that's collected is definitely a major goal and also underscored in the literature. In addition, as Cookie mentioned, it's important to ensure that the data that's collected is culturally aligned and that it's accessible to the people who are using it. Not only the people who are receiving the care, but also the folks in the community, like tribal leadership, who receive a lot of requests to address these personal issues and who need those dashboards and the accessibility of information to best support the folks in need. And so that is another piece that definitely was a critical core piece to updating the data that's collected for the tribe. And then finally, WIDA and colleagues note in their 2021 paper that there's a real need to incorporate a trauma-informed approach using social determinants of health to understand data system alignment and identify those external factors of structural racism that can affect our internal factors of implementation rollout of systems alignment. And that, of course, is something that's central to this mechanism as well that we're funded under. And so it's important to understand that as kind of a backdrop and within that box of external factors because of where the tribe is located and the availability of different services and some of the issues that are built into those services from the agencies that provide them. It can be really challenging for folks in the community to access them because of those issues of racism and discrimination within the healthcare system and other types of systems, including the educational system. And so understanding that was really critical in order to be able to address that need and be able to weave in certain supports to help ensure that folks within the community are able to get meaningful access to care. And now I'd like to go ahead and turn it over to Tammy to talk about the Coeur Adolescent Support Team, or CAST. Thank you. Oh, and you can go to the next slide.
Hello, everyone. My name is Tammy Dorman. I have worked for the Coeur d'Alene Tribe Department of Education for the past 24 years, primarily in early childhood. I would like to give you some background about the implementation of the Coeur Adolescent Support Team and the role I have on this team. As you have heard already, community data was showing us that there were gaps in services to our youth, and many were falling through the cracks. As a result, the decision was made to create a multidisciplinary team to address the needs of our youth ages 12 to 17. As you can see on this slide, this team consists of a wide variety of professionals and service providers from youth advocacy services, the Department of Education, behavioral health, career renewal, Indian child welfare, the Coeur Center, tribal courts, the University of Idaho Extension, and local schools. Our CAST team meets bi-weekly to discuss open referrals and how to best provide services to our youth. Without each individual at the table collaborating to address the needs of our youth, we did not have a complete picture. A little bit more about my role specifically. I have been a volunteer in our local schools for many years. I have 4 grown children who are tribal members and graduated here. And I currently serve as the liaison between the Department of Education and our local school district. This has been very successful because of the strong relationships I have with their staff. And because I've spent 22 years in early childhood here on our reservation, I've known most of the children that are being referred to CAST since they were infants. We have seen these repeated cycles and the need for more strategic intervention. The CAST team brings professionals to the table to connect resources for these students. Referrals can be initiated by parents, the students themselves, and community members such as our CAST team professionals, including the schools. The schools spend a lot of time with our kids and they're seeing their daily struggles. They're sometimes at a loss of what to do with only limited resources. CAST is a place where students are connected to comprehensive services in a wide variety of areas. Our goal is really to build the relationships with these students and improve the overall wellness of our youth and their families. And next you will hear from Joey Buckner, our Well Variety Services Manager, who will explain more about the process from referral to staffing the necessary services for each case. Thank you.
Thank you, Tammy. Hi, my name is Joey Buckner and I'm the Well Variety Services Manager. I've been in this role just a little over a year. So once we get a referral, whether it's from behavioral health, the schools, self-refer, just people in the community, or from CAST, we move our people into phase 1. And that's a referral process. So we get the referral, we put it into an air slate, we then send it to CAST, they accept it, our staff will send it back. And then we fill in all the things, and then we're able to kind of start tracking our kids and our youth. We move them into a phase 2 once we're able to get them in, whether we go meet them at the school or we get them in here and we transport them, or we meet them at their home. We figure out what is an area, a space that they feel comfortable meeting us. And then we do a North Point assessment on them. We do the North Point assessment and it figures out if they're high risk, low risk. And then we determine their individual service plan and what their needs are for being able to be met. We also do their crisis intervention. We do their case planning with them. And the whole time we have them like helping us along. And this is where we get to figure out, are they couch surfing? Are they coming to school late because they're not able to get up at 8 o'clock because their parents are fighting every night and drinking every night? So we're able to help them identify the barriers to being successful. And then our phase 3 is our care coordination. That's where we get to come in and we get to advocate for them. We've advocated for some kids to have a late start because they're not able to get to school at 8 o'clock. Can we do a late start and they start school at 9 o'clock? Are they not going to school because they don't have a ride and they miss the bus? And so there's many obstacles that our youth go through. And so that's where we get to come in and we get to do our wraparound services. We get to help them along. We help their hands. We get them into counseling. We have a teen closet. Sometimes kids don't go to school because they don't have laundry detergent. They don't have the shoes to get to school. So we get them into our program. We get them signed up. We get them into our teen closet where they're able to pick out 5 new items, from shoes to socks to feminine things to jackets, just those things. And then we have an area of our closet that is donation, and they can pick however many items that they need from that closet. And then our phase 4 is that's just the aftercare. We may graduate them from CAST, but we keep them in as YES. And then we just do our monthly check-ins with them, or they call us as needed. Yeah, that's pretty much how that goes. And then maybe I'll talk a little bit about, I was one of these kids, right? I was a kid who was raised by my grandma and she was elderly. I was a kid who fell through the cracks in school, and I quit my senior year because I was so far behind. So I think this program is beneficial, and where my drive is one, I'm 6 years sober and counting, but I was also one of these kids that just struggled in life. And so this program to me is beneficial for our youth. And if I could help just 5 youth, throughout the year, help be successful, to help achieving their goals in life and be able to graduate on time, then I've done my job. And that's where I feel like this program and our referral system is on point, and this is beneficial. Thank you.
Thank you, Tammy and Joey, for sharing your personal experiences and insights into the realities of the CAST program and this process. I will go ahead and take it from here. Sadina, if you can go to the next slide. Thank you. So this information has directly contributed to the outcomes and deliverables we hope to come from this project. In the next few slides, I will provide a more in-depth look at each of these identified outcomes and deliverables that you see here that include universal intake, referrals mapping, the dashboards, interviews, and tribal data affinity group. Next slide, please. So first of all, we are designing a comprehensive universal digital intake form or application that is simple and can be used by all community members seeking services from tribal departments and programs that are targeting health, social services, public safety, and education. We will use this information within the form to extract important demographics and programming needs. In order to create this form, we gathered and inventoried 25 different forms from various departments to compile a list of the top most frequently used fields and develop this draft universal intake form that is shown here. In order for this intake to truly be universal and reduce the paperwork burden, it is crucial that we are able to develop a database to house the information from the intake form and make it accessible to the necessary departments and service providers. Next slide, please. This diagram here shows a few target areas that the Youth Advocacy Services program aims to address with the youth in their program. As Joey indicated, they do a needs assessment with the youth when they enter the program to be able to identify the target needs. And there are 3 types of referrals that were identified prior to this project starting, and those include formal, informal, and some are automatic. And those are what is currently in practice. So this project will focus mainly on digitizing a lot of the formal referrals that are currently done on paper, or like Cookie said, through email or in person. However, we will also be looking at formalizing some of the informal and automatic referrals, and those are indicated by the red color font that will be included in this project. Not only will this process allow for more improved data collection and reporting, but also ensure youth are getting the services they need to allow them to be successful now and in the future. Next slide, please. So here's a look at our current dashboards that are in development. We've been able to create these since our current electronic referral system went operational in November of 2022. And we've been fine-tuning them since then. As you can see, we are able to use the data from the referral forms that are sent from YAS to the CAS team to create dashboards showing certain demographic data. From these dashboards, we are able to gather that a majority of youth being referred to YAS so far are Coeur d'Alene tribal members, mostly female, and mostly around the ages of 13 to 15, with the highest number being age 14. And you might see these request parent involvement and alternate adult. That information we're gathering because of the tribal resolution that allows youth 12 and older to consent to their own behavioral health treatment. So the YAS staff encourage youth to involve their parents and another adult, but as you can see, at least from the time of the initial referral, most youth are opting not to involve a parent or alternate adult from the beginning. Next slide, please. In addition to the demographic data, by using email addresses and timestamps, we are able to track which staff are generating referrals and when. This adds a layer of accountability and assists management when determining appropriate caseloads for YAS staff. And over time, we anticipate being able to see when the spikes of referrals are, such as, in the fall when school is first starting up. But we will continue to watch those and watch the dashboards as we get more referrals and as time goes on. We are continually evaluating the referral forms based on the data and the dashboards that we feel are needed. Here we have reason for referral, and that's a new field because originally the reason for referral field was a free text box, and we realized that we weren't getting very consistent data from that, and we weren't able to report on it very well. So we did change the forms to include check boxes so that the person entering the referral can check one of these reasons or put in other and still have a text box if it's not included in the form. And that just helps us be able to collect the data and watch these counts a little more closely so that we can identify where the true needs are. But as you can see, so far since implementing this field, the schools are reporting mostly referrals for attendance and grades. Another area we'd like to further develop is tracking the outcomes. As of right now, when a referral is closed, they'll put a reason for the closing of the referral, whether the services were rendered or they were unable to contact the client or the client just refused services. But we would like to add more long-term outcomes into these dashboards to be able to, really see how the CAS services are making an impact with our youth. Next slide, please. And at this time, I will turn it over to Christina to go over the interview findings.
Thank you, Marquette. So we've conducted interviews through October and November with the purposive sample that we chose of cast members, administration, and IT, so the users of the referral systems and developers. In keeping with our approach that was Indigenous-led, participatory, and really with that user-centered design, as well as looking at practice-based experience. So within the semi-structured interview, we asked questions around the history, the present and future context of the referral system, asked about roles and connections to community, use of screening and referral system, in particular focusing on that, as well as dashboard considerations. Our initial findings really show the connection that you've heard through this webinar with tribal members and community members with a long history and connection to the community. That's at the heart of this study and going forward with developing a referral system and dashboard that best meets the needs, not only of the programs, but for the community to have the greatest impact. There's a history of tribally led initiatives that identified the gap and goals across the programs. We asked around strengths of the referral system and use, and definitely these are, again, also preliminary findings, looking at the benefit of improved quality of care, that wraparound service, really improving coordination, and really sharing information across the programs. What a strength that came out from the interviews that was alluded to before as well was tribal leadership engagement to support across governance, finance, data system development, and active engagement, not only because of customary role in the tribe to best serve citizens and community members, and also with an interest for supporting addressing any structural determinants that keep the system from working as intended. There's cross-sectional relationships that are built on trust across the CAST team. Those really came forward in initial interviews. Again, a community connection, a sense of accountability and responsibility through continuous communication, a desire for strong data sharing agreements and action was something that was seen as a challenge and needed. Taking time to spend on the paper intakes. So as was referred to before, moving towards online to really support team members in moving those referrals through to connecting youth with the programs identified and needed. Another challenge that was identified was the need to share the intake process and paperwork to reduce redundancies, and also look at that universal intake form, and also the need for release of information. So really addressing federal policies as well, and finding what will work for the tribe. That when we asked about programs to be included by a tribal-wide referral system and connection, all social services programs were identified, judicial and probation was identified, as well as education. In terms of the dashboard, it's key that clients' information that is similar across the program. So it's really important that it's information that is relevant and meaningful across the programs. It's important and to include clients' progress on reaching goals. So, and then ultimately being able to generate the reports that are meaningful and useful for the programs. Some of the supports that we asked around using the referral systems had to do with increased training, one-on-one troubleshooting, and a suggestion of doing competitions or incentivizing teams or individuals to use the referral system. So those are our initial findings, and we look forward to diving deeper into the data for future presentations as well. Thank you.
Next slide. I think, Christina, you might view this slide as well.
Thank you. So this slide refers to the affinity group that's really emerged. It came out of Our Nations, Our Journeys, which was a national conference that 7 Directions held. And we reached out across those contacts that we had that were doing similar work around tribal data systems development and strengthening. This also came off of initial conversations with White Earth Nation that has a similar experience in developing referral systems. And so what's emerged out of that are monthly meetings that we're continuing with various tribal nations that are working in this area. And we have submitted an abstract to participate in a discussion to really continue to gather like-minded tribal systems, health departments, social services, cross-sector systems, teams that are working in this area of developing infrastructure and capacity to do align across all programs around data. Again, infrastructure and capacity. So we're looking forward to that meeting. I think it'll be really important to be able to invite people to join in that conversation and grow this network that's emerged. So we're really excited about that as an outcome of the study so far.
Thank you, Christina. Next slide. So as we wrap up the presentation, we wanted to leave you with a final visual of an emerging framework that's that is based on the one we showed earlier, which was built from the previous cross-sector alignment theory of change, and one that we feel better embodies our ultimate goal to center tribal sovereignty and solutions for systems alignment. Because we seek not just for the alignment of our services, but also just to better understand the cultural circumstances and realities of the population we serve. We believe that the dashboards and this referral and intake process will help us do that. We're committed to drawing not only from existing literature and practices, but the abundant wisdom and inherent wisdom and knowledge and resources that from the Coeur d'Alene tribe and people that will hopefully result in customized solutions and better health outcomes. Using this beadwork and as an analogy, all aspects impacting long-lasting community change are represented by the individual beads that, along with extensive and deliberate and at times very painful hard work, we are able to create something that truly exemplifies our community. Through this cross-sector collaboration with public health, social services, our tribal leadership, education, public safety sectors at the table, we are experiencing true community engagement and action. We are changing our practices, policies needed to align with the healthy community that we envision, and we're taking the necessary steps toward health equity and outcomes. Marquette?
Next slide, please. So that brings us to our conclusion. We hope that you were able to get a good idea of what our project is about. Our collective years of experience in this work and research is fueled by the love and determination to meet the needs of our communities, promote equality, and to improve the quality of services offered to our tribal youth, especially those most at risk. Prior to colonization, tribes had established evidence-based systems and ways for making their communities and families run cohesively and in unison with one another. Sadly, there is a long history of harm and disruption experienced by tribes, causing these systems to break down. Today, we continue to use innovation, purpose, and cultural resources and experience to repair and revitalize our communities through hard work and unrelenting dedication to protecting and preserving our community's strengths and celebrating our resilience. thank you. And now I'll turn it back over to the Systems for Action group for the Q&A.
Thank you so much for your entire research team for providing these exciting and very, very important updates about your project, about the gaps you've identified among the youth in your tribe, and how the CAST dashboard and referral process can address those gaps. I'm personally looking forward to continue learning from you and your team as the project moves forward into your implementation phase and to see what happens next and what your next steps will be. So thank you for joining, and thank you for being vulnerable and sharing your own personal experiences. And I know this project is really near and dear to your heart as it's your own personal community. So thank you so much for providing those updates. One thing I did not mention at the top of the hour is that our Research in Progress webinar series is an ongoing series where we invite our Systems for Action researchers to come and provide updates through this webinar series about their projects. So typically they'll come and provide an update at the beginning of the project, just as they're getting started, and then they'll come back again either in the middle or at the very end of their project. So this is the Coeur d'Alene tribe's first presentation in our webinar series. They will present again when their project is over. So you'll have some exciting updates about how their project is wrapping up and their final findings. So we'll make sure to keep you updated with the schedule and as that moves forward. So with that, I think we can go ahead and move into our Q&A. So if you have any questions, big or small, please enter them into the Q&A box. And I'm going to go ahead and get started with our first question from Aaron Poole. They are interested in hearing more about how the caregivers and providers take care of themselves and support each other so that they continue this amazing work.
I am going
me
to
to answer that?
Yeah, I was going to say Joey is a perfect person to answer that.
Well, to be honest, it's a struggle, right? Because we live on the reservation, we work on the reservation, and we know everybody and every family and everything. But what I am working on, because I'm very bad at it, is I take time off now, like whether I come in late or I just do things with my son. So I'm learning to disengage. That's whether honestly, me and my son love to go shopping. But it's just being in the mountains. I love to go huckleberry picking. That is my time. That's what we do. I teach my family hunting, so we go out and hunt. So I do things with my family that is away from here. And that gives me that time to be able to recharge and to fill up my own glass, because I'm filling up everybody else's glass, but when do I fill up Joey's glass? So that is a work in progress.
Thanks, Joey. And I'll just throw in real quickly that one of the things that's made this process work for us with the Tribal Collaboration Committee and team that comes together, that includes all these people that presented today at the table, is having us all at the table with the leadership and basically have them sitting across from you where you can just like talk directly to the decision makers on what you see as a provider, what is working and is not working. That often doesn't happen where you get that direct access and direct communication. And we also have accountability at the table. And I think that those are things that, stress a lot of us out when we know that programs and services aren't working, but we don't have a venue for sharing those gaps and figuring out how to address them. So I think part of our self-care is being at the table and telling our stories, sharing what we're seeing of what's working, what's not, asking for help and input from all these different partners that are in it with me to help these people that we care about in our community.
Cookie.
Yes.
I was just going to add to that I feel like being on the CAST team with Joey, like it all goes back to those relationships too, because I feel like as service providers and professionals in each field, we have great relationships together as well. And so we work really well together, and not any one person is taking all the weight of everything. So when Joey's team staffs these cases, I mean, it can be with a wide variety of individuals as well, but I think we trust each other and we have great relationships as well. So
Thank you.
Thank you all. Did anyone else want to chime in? I don't want to move on to the next question in case somebody wants to add to that. Okay, I don't see anyone coming off mute. I am going to move on to our next question, which is kind of, I guess, a personal question, but I'm going to transition it into another kind of question. But Miguel is really curious about if it's possible for other groups to join your tribal meeting. And I guess they're talking about the tribal affinity group. So could you talk a little bit about a little bit more maybe about how that developed and what those meetings look like and what the longevity of those meetings would be, and maybe potential possibilities of others joining in for the meeting if that's available?
Christina, would you speak to
Marquette,
that a little?
Just gonna say, Marquette, do you want to support this as well? I believe so. Definitely reach out to us. If you're in the similar place of working to develop out your tribal data system, it's identifying not only the technology that'll support that, we're moving towards thinking about, and we come together around public health, accreditation, and around developing out the system for that. So indicators, performance measures, as well as this looking at the interoperability of the technology. So I would say definitely reaching out. It's definitely coming from Coeur d'Alene now, even though it started with the ONOJ conference. So
Yeah, I think we've only met a couple of times since the ONOJ conference, and we have a plan to maybe meet in person again at a conference in April. And we're setting our goals and objectives for that group. They're still in draft, but we're finalizing those. And so we can certainly maybe share those if you reach out. And then if it aligns with, you know, what your tribe or organization is working on, then we'd, you know, the more the merrier. Basically, we're sharing information. And so we want to share what works, and we want to hear from others what is working as well.
Thank you. I think we have one of our Systems for Action team members maybe making some connections there. So Miguel, stay tuned. And move on to our next question from Larry Bierking. Does your data system require dual data entry by each partner agency, or is there some kind of system interoperability? Can you share any technical details regarding the underlying technologies?
I'll go ahead and take that one. So it has been complicated because not any one of our tribal departments at this point is using the same case management system or the same software. And a lot of them are still in Excel or even paper files. So it has been a challenge to find something that will work for all departments. And at this point, we're limited in the number of departments that we have added to the referral system. Basically, it's a combination of, you know, some free and paid for softwares that still takes quite a bit of manual labor for, you know, a couple of point people, one in IT and then one is myself, to kind of filter out that data and get them to the dashboards. But the idea with that was, one, it's cost effective, and two, it doesn't take an IT programmer or someone with that type of background, because a lot of tribes don't have those professionals working on their teams. So we did have the help of a contractor program developer in the beginning who helped us set those up. And then now we're slowly, you know, learning those and taking them back over. But there is some dual entry. The referral system is separate from the case management system that Joey and her team use at this point. But we are taking that into consideration and hoping to resolve some of those issues in the future.
Thank you, Marquette. I think we have time for maybe one or two more questions. I see two questions that are sort of similar, so I'm going to ask Michael Schaefer's question because I believe it covers some of the other ones that have popped up as well. But he asks, given some of the historical misappropriations of tribally based health data and the historical colonization of research in tribal communities, how has the relationship between the tribe and the university and RWJF been navigated regarding data sharing and especially research dissemination?
I can address that real quick. So our standard at 7 Directions is that the tribe owns the data, and we have limited use of the data. And so we have access to it for the specific purpose of the project. but we do not own it. And that's different from every other university project. Usually a principal investigator based at a university setting has intellectual property. The data is considered to be intellectual property that they collect. And so this also speaks to kind of the indigenous data sovereignty aspect that Christina touched on earlier as well, which is that tribes are separate jurisdictions from state universities. You know, our work is done under the state of Washington jurisdiction, but we recognize the tribal jurisdiction and the inherent sovereignty that tribes have and have always had to control and maintain and have ownership over their own data. So, you know, I think the question raised the previous harms that were committed by a researcher based at the Arizona State University and then University of Arizona. And there was a lot of harm and stigmatization that resulted from her sharing her data with a lot of other researchers that focused on projects that were not actually included in the informed consent forms that tribal participants signed when they agreed to participate in a diabetes research project. So since that time, and even before that, actually, tribes have required data sharing and ownership agreements when they work with universities. And our standard, because we are Indigenous researchers and we work with many tribes and other Indigenous communities, both in urban settings and also rural settings, is to adhere to that highest level of respect for tribal jurisdictions and abide by those requirements of data ownership and management. So when this project ends, all of the data will reside with the tribe. We're just here as technical support to ensure that, you know, we're able to provide that analysis and other types of interpretation and translation, but we're not here to take the data and then do whatever we want with it.
Thank you, Dr. Parker. I think that was beautifully answered. I think maybe we'll ask one more quick question. I've seen some other questions come up specifically about the dashboard that you're using. Did your IT partners vet the software for the dashboard, and how did they build the dashboard? And if they didn't, I guess, build it themselves, what is the name of the dashboard that you have implemented?
Yeah, so like I said, we're using a combination of some free softwares. So we are using Slate as the actual referral forms. And then from there, the data is copied over to Airtable, which then our dashboards pull from that. And that we're looking using Google Looker Studio. So there's a lot of manual work involved with it, but it does produce some dashboards that, you know, that we showed you and that are working for us at this point. And then something we didn't really mention in the presentation, but simultaneously, while we're developing this, we're also doing some SWOT analysis around already existing referral systems and softwares and case management softwares, just because we don't want to dismiss anything that could be beneficial for us in the future. But for right now, this is that's what we're using.
Wonderful. Thank you so much, Marquette. I think in the sake of time, I think we have a couple of systems for action announcements, so I'm going to go ahead and move forward. Thank you so much, Sadina. So we do offer certificates of completion for coming and attending these webinars. So if you're interested in receiving one of these certificates, there will be a very, very brief survey at the end of today's webinar, and you can indicate that you would like a certificate, and we'll get it to you in a timely manner. Next slide. So as I mentioned before, this is an ongoing series of webinars that we host. We're going to have a special presenter presenting on December 6th. I believe that's next Wednesday, from the System Alignment Innovation Hub, which is a new partner for Systems for Action. And we're excited to have them come and present and talk about all the very exciting research opportunities and other ways that you can engage with the System Alignment Innovation Hub. We'll include information about signing up for this webinar in the follow-up email that we send. And then, do we have one more slide? Yes. So this team applied to a funding opportunity that we released in 2022, and we're anticipating releasing our next funding opportunity in mid-December, so that's any day now. We will have a couple of informational webinars that we'll be hosting in early January so that you can learn more about this opportunity. There will be two different types of funding categories available: a developmental award, which is what we're referring to as some pilot studies, and then an impact award. And this specific call is really interested in helping medical, social, public health systems work together to dismantle systemic racism. So we're excited about this opportunity. And if you're interested, then we will definitely include some information about signing up for those informational webinars, and we will be promoting this heavily. So you'll have more information about the funding opportunity soon. I think that's it for our announcements. Thank you so much to the research team for coming and providing these really great updates. I love hearing from you guys. And we're looking forward to continuing this research in progress webinar series. So thank you so much for everyone who joined today, and I hope you have a wonderful rest of your day.